Without hospice and without palliative care, people experience death in a way that doesn't align with their personal values and belief systems and their personal goals. At Pikes Peak Hospice and Palliative Care, we listen to our patients and we build a plan of care around those goals to make sure that we give them the death that they want in this sacred part of our life journey. Hi, my name is Dawn Darvalix. I'm the president of Pikes Peak Hospice and Palliative Care in Colorado Springs. We have been a pioneer in the hospice movement since 1980, serving the community as the only nonprofit hospice and palliative care provider for 42 years. As the only nonprofit provider, it is our mission to provide high-quality end-of-life care to all in our community who need it, regardless of their ability to pay. We have a very robust Center for Grief and Loss support where we offer individual counseling to family members who are bereaved because their loved ones died on our service. And we also offer grief support services in the form of support groups and also do things for kids like children's grief camps and children's support groups. Pikes Peak Hospice relies on dollars that are donated from our community members to provide additional programs and support to our patients and families. Our regular payers include Medicare, Medicaid, and private insurance companies, but that reimbursement does not cover special programs like our patient special needs programs. We have many patients that we serve at end of life who are financially constrained and they need support. Maybe it's staying in place and they're back on their rent payment, so we can use those dollars to support paying their rent and keeping them at home. Maybe their refrigerator has broken and they need that refrigerator for food and also medications. We can help with that. We also have a program called Sentimental Journeys, and this is a program where we create experiences that are bucket list items for our patients and their family members. Just the other week, we actually sent one of our pediatric patients to a concert that they really wanted to attend. It was really meaningful to them. We have sent people on picnics, family picnics where we've catered the food. We have hired photographers to take one final complete family photo with the matriarch of the family and all of the generations surrounding her. Those are some examples of how we use the dollars. Also, we have a very robust charity care program, and we use those dollars to pay for the care that we provide to people who are uninsured and have no means to pay for healthcare services at end of life. Another way that we use community-raised dollars is in the care of our pediatric patients, both on palliative care and on our hospice services. Those parents require a lot of support, a lot of navigation through the situation that they're dealing with their kiddos, and we want to provide that services, so we're able to do that with the dollars that we raise. Also, at Pikes Peak Hospice and Palliative Care, we have the only dedicated hospice inpatient in El Paso County. And with that inpatient unit, we can provide care 24/7 in our 8-bed private suite at Pemrose Hospital and have around-the-clock care delivered by our end-of-life care experts. We also have a very robust volunteer program, and in that program, we can offer pet therapy, soothing sounds therapy, which brings musicians to patients to really relieve some of the anxiety and stress that they're feeling. We also offer Reiki services and so much more. And we're able to do that through the time that is donated from our community members to our patients and families. Many of our volunteers have been touched personally by the services that we provide because we have cared for one of their loved ones. We also have a veterans program. We are the only Level 5 participant in the Colorado Springs region with the National We Honor Veterans program. We're very proud to support the veterans in our community. There are so many of them, and the needs that they have at end of life are definitely unique. We have also invested in having a full-time dedicated veteran liaison in our community so that they are having those conversations with veterans, that they are helping them navigate the sometimes hard to navigate VA system and can really be there as someone who understands vet to vet what that patient is going through. We do bedside salutes and pinning ceremonies for our veteran patients as well. We are also accredited by the Accreditation Commission for Healthcare, which is an important differentiator in that we set the bar high and make sure that each of our patients and their families receive the highest quality of care possible. We are so grateful for the support that we receive from our community members. We are able to do so much more for our patients and families who are on service with us at Pikes Peak Hospice and Palliative Care because of the generosity of our community. We are eternally grateful, and we create lasting memories for the family members of those who are on our service long after their loved one passes. Thank you.